What learning and development's on offer?
So there's in-house training and support, which is either mandatory or specific to the job role that you're doing, as well as you can work alongside your manager to have a development pathway that you would follow over 1, 2 or 3 years. I'm concentrating on supporting staff on the advanced clinical pathway, and within that there's training in-house but also university courses to work towards a master's in advanced clinical practice.
Oh, that sounds interesting. So can you choose your own pathway, or is it something set for you within your job role?
So it's set within your job role to a degree, but also there's opportunities to have a discussion with your manager, and if you and your manager both feel that it would be beneficial to your job and to you, then you can plan something different.
I've also felt working within a pharmacy environment in a prison that I'm being able to do courses that I would never have even dreamed of doing out in community or in hospital. And also enriches your job as well. So like your smoking cessation, if you've got on one of them courses, it means that you can hold clinics, meds management, then you can actually help with reviews, things like that, which you wouldn't get a chance to do anywhere else really.
Plenty of opportunities
Definitely.
for CPD then.
Yeah.
I echo their sentiments. It's not just the opportunity for training and the variety of training courses. I really appreciate the culture behind it as well. So you never feel that you can't take time off to attend these training opportunities. You're constantly supported by your manager and the wider team to go off on these training courses, but then also to come back and integrate what you've learned in the team, and it just makes you feel more valued and more progressive, and it really helps in terms of the innovation of the service as well.
Why would you choose offender health over another community speciality?
For me, it's the variety of what you're seeing daily in terms of the patients and their healthcare. My experience in the community, for example, if you're working in a hospital ward, it can sometimes feel like you're very condition specific, but given the population in the prison, you have patients there from who are aged in their teens up to their 80s or 90s and everything in between that. So you're responding to emergency incidents, or there's the management of chronic conditions such as epilepsy and diabetes. You're seeing patients there with substance misuse disorders and mental health conditions. So every day you're getting some aspect of all those in together, and so you're constantly learning and your clinical judgment is constantly being tested.
I think with it being quite a holistic approach to when you work in a prison, it's completely different from anywhere else that you can ever work. Everyone integrates so much, and it's all about trying to deal with a patient's physical, social and psychological needs.
For me, it was about, I've worked in the community a lot. I've worked in lots of different areas in the community, and prison healthcare as a rule is very much all of those areas under one roof. So for me, it was the best of all worlds. There's no particular area that I dislike, but I very much enjoy it all. So to work in a prison where you've got your continued care, you've got your emergency care, you've got your opticians, you've got your physiotherapists, and the referral pathways into that, you've got your GPs. So it's just nice to have everything under one roof. So there's always scope for opportunity, there's always scope for learning something different, and there's always an expert somewhere that can help you if you need that assistance as well. So that was my main reason for deciding to go down that route.
So you would say it's a very varied job?
Yeah, no 2 days ever the same. Yeah. And it's just nice to see that you actually can make a little bit of difference. And it's quite, with it being the environment you're in, you can actually see that effect happening like day to day, on a day-to-day basis.
Yeah, you must have a huge knowledge base of lots of different things going on as well.
Another thing is that we work alongside patients, so we're not judgmental. We involve them in their healthcare and their decision making around their healthcare, and give them every opportunity to be able to manage their health independently.
And I think they appreciate that through feedback that we get.
Sort of
through,
feel valued and positive.
We make every contact count when we see somebody, and that helps them sort of along their journey around in their healthcare.
And it is part of that journey, you know, they're in there for whatever reason that may be, but actually the healthcare that you're providing as well also helps with that reintegration, if you like, back into the community, because they get their voice back. A lot of them may not have been in control of anything that they've been able to do with their life up until this point. So to sit with them and tell them that you care and that you understand and that you want to help make a difference with them really goes a long way.
So whilst there's the opportunity to kind of share and learn from other teams, there's just as much emphasis to specialise in certain areas as well.
What do you think makes someone successful here?
You definitely need to be flexible and adaptable. Given the environment, the regime is governed by the prison, so sometimes it can be difficult to get access to the prisoners. So you need to be innovative in the way that you deliver healthcare sometimes.
I think it's really important as well to be non-judgmental. You're working with a wide selection of people with all sorts of different backgrounds. Ultimately, we're there to deliver a service, and I think to do that effectively, you need to be non-judgmental.
What shifts are available?
So Bristol Community Health place a lot of value on being family friendly and flexible. Only 2 of our sites require night work, and some of our teams only work Monday to Friday and don't require weekend work-in. So there's definitely scope to find a role there that suits you and your needs outside of work.
I think the chance of doing bank shifts is also good for work-life balance, because it gives you the opportunity to work the days that you want to do, or overtime if you feel you want to do any overtime work.
How can I find out more about working in prison healthcare?
We've got regular open days where you can come and meet the staff there and also experience the environment.
You can also do shadow shifts if you want, to see how we work on a day-to-day basis.
What do you get out of your job role?
For me, as clinical lead, what I get out of my job role is sharing and expanding the clinical knowledge within the teams.
It's a nice feeling that you know that during your day at work you've actually made a difference to someone's life, and it's really rewarding.
The patient engagement is really rewarding because the population are so usually disadvantaged in terms of coming from social economic backgrounds, and then they're in an environment then which is very difficult. So when you are able to help someone, it does just feel so much more like you've achieved something.
For me personally, I get a massive sense of achievement from doing what I do. Clearly get to see the results from making a difference to just an individual, if you like. So to go home at the end of the day knowing that you've actually achieved something and you've made a difference to that person's life is really humbling.